Welcome to the Economy and Politics Show. I'm Ottoabasi Abasiekong. The Ebola pandemic is the most virulent viral disease known to mankind. Its recent outbreak in West Africa 6 months ago, which hit Sierra Leone, Liberia and Guinea, becoming a serious epidemic, is unprecedented. The World Health Organization has described this as a real international health risk and warns of a case of 10,000 per week if it's not curtailed. Nigeria would have also been another story of an outbreak of the Ebola, but not for the spirited effort of the federal government in partnership with the health and private sector stakeholders. In this edition, we'll be looking at 3 lessons the globe can learn from the strategic approach Nigeria took in curtailing and containing the Ebola pandemic. The first is the rapid response of the federal and state governments. When the first case of Ebola was recorded in Lagos, the federal and state governments collaborated and effectively swung to action by declaring a state of emergency and also locating about 1.9 billion naira to tackle the pandemic. This was a show of strong political will to ensure that this pandemic did not ravage Nigeria. Dr. Diola Majiade, in her presentation on the socio-economic impact of Ebola in West Africa, highlights how the government response helped to contain the pandemic.
Political leadership and restoration of confidence. The Ebola crisis was managed in Nigeria. The way it was managed restored confidence in governments at the federal, state, and local government levels. The presidential commitment and declaration of a state of emergency was a powerful tool to galvanize and mobilize the populace against the Ebola threat.
The second is the NCDC Case Management and Infection Protection. The National Center for Disease Control in Nigeria, based in Abuja, did a remarkable work in ensuring that there were clear case management and infection protection with collaborations with the Ebola Emergency Operations Center and the isolation centers. The necessary framework and structures to ensure that proper monitoring, investigation, and clear analysis were done to contain the Ebola pandemic were given full priority and deserve commendation. But Dr. Diola Majiade highlights how this impacted the whole tackling of the pandemic.
Case management and infection prevention and control. An isolation center was established by the Lagos State Ministry of Health at the existing infectious disease hospital Yaba for case management. And this highlights the fact that we can't contain Ebola without pre-existing institutions that we would leverage on to be able to do this. And that is why, that's the difference between the spread of Ebola in Nigeria and the other West African countries where the health institutions and systems are not that strong.
And number 3, the role of the private sector. The private sector showed leadership and support during the trying period that Nigeria experienced the Ebola threat. Owando PLC, notable exploration and production company in the country, through the Owando Foundation, set up the Education Trust Fund to cater for children of the deceased from the Ebola pandemic, ensuring that they continue to get support going to school and becoming great citizens in the country. Seplat Petroleum Development Company, another key player in the oil and gas sector, donated 50 million naira, 30 going to the first consultant hospital where the first Ebola case was recorded, and also 20 going to the Lagos Isolation Center to equip the facilities there and ensure that this infrastructure was provided to treat the Ebola patients. MTN, a key player in the telecommunications industry in the country, donated PPEs, which are equipments and protection gadgets for the health workers to ensure that do not transmit the disease from the patients. This helped to contain the effect of the health workers being exposed to disease, as was the case in Liberia, Guinea, and Sierra Leone. The Tony Elumelu Foundation donated 100 million naira, 50 going to Nigeria and 50 also going to Sierra Leone, Guinea, and Liberia. The Dangote Foundation donated 150 million naira to the Ebola Emergency Operations Center, which enabled them to also treat very sensitive Ebola cases and also provided necessary infrastructure to ensure that this pandemic did not break out in the country, becoming a serious disaster. looking at the role of the private sector, looking at the political will of the government, and also the institutional framework which enabled the health sector carry out its role during the Ebola threat, one can say that Nigeria proved analysts wrong on the narrative that things cannot be done properly or that the country cannot respond to emergencies. It also showed that the interplay between the public and private sector, particularly on this Ebola threat, if replicated to other sectors, could bring Nigeria to a level of transformation. It also showed that Nigeria, after the commendation from the United States of America, the World Health Organization, and even the United Nations, can become a key player in the scheme of things globally. Also, it is one thing to once again note that Dr. Ameyo Adadevoh, the heroine doctor who first alerted the state and the federal government on the Ebola case, the first Ebola case that was recorded in the first consultant hospital, played a key role in ensuring that Nigeria was equipped to tackle the Ebola pandemic. We urge the federal government to honor this great woman for her selfless, dedicated service. And that will be all for this edition of the Economy and Politics Show. You can join us on our social media handles for interactions, Facebook and Twitter, and log on to our website www.webtvng.com for further information. Thank you for watching and have a lovely day.